Our strategic plan is the roadmap to our success, and it really entices us to be healthy together. At the hospital, when you think of health care, you think of clinical care. You think of people going there to fix broken bones, to have operations. And not everybody thinks about mental health as health, and we've embraced it as part of the whole picture of health. We want everybody not only to be physically healthy, but mentally healthy. We've come to discover, and I think society in general knows that mental health is as important as physical health. So when we talk about a strategic pillar, we've committed that not only are we going to fix you physically, but we're going to help you with your mental health. One of the things that we're kind of proud of is the relationships we've built with outside influences.
Since Stephen took his life, 4 of his friends have ended their life. And a good friend of ours last year took his life, and he was 68 years old. So it happens to everybody, no matter what age you are. So I think it's just sort of trying to help erase the stigma around depression and mental health, and letting people know that it's okay to ask for help is important to me. Stephen was interviewed in the hallway. There was no privacy. And asking somebody in the hallway of a hospital, are you thinking of ending your life? They're not really going to probably tell you the truth at that point. So I think making the hospital a place where people can go and get help, and it's confidential and it's private, has been a real priority for me. My involvement being on the mental health emergency room department has been really beneficial, because they're revamping the hospital right now to provide a space where people present with mental health issues. It's going to be more of a private space. There's going to be nurses and doctors that are going to be there and trained in mental health. Yeah, I think based on some discussions that I have, and when I meet once a month, you hear different things about people's experience in the hospital. So I think even just that awareness that people who need to be trained in mental health. I was in the hospital probably about 6 months ago. A friend of mine called me because her husband had attempted suicide. So when I went there, I found that the nursing staff were way more responsive. Just talking to the wife a lot about services and help, and they're very respectful of this man who tried to end his life. Because before, they wouldn't even really talk about it. So now they were talking about that, mental health is a real issue and stuff like that.